Katie.
Hi.
It's very nice to see you again.
Good to see you.
My name is Dr. Matt. I'm going to do your examination today. How are you feeling?
I'm good. I'm here because in the past couple months I've started to feel shaky in the hands and legs a little bit out of nowhere.
Okay.
It's not related to being hungry or it's not the blood sugar drop kind of shaky. It just happens for no reason. And my face kind of gets twitchy from time to time, so I'm worried about that.
Okay. So just these two symptoms, when did they start?
Started 3 months ago, and the twitching of the face started about a month ago.
Okay. Any new events going on in your life?
A divorce? Yeah.
Okay. That definitely can bring in a lot of stress.
Yeah.
Physically and psychologically. So
Yes.
let's see. Have you noticed any numbness or loss of sensation?
I haven't, but I get cold really easily, so I guess I get numb because of that.
Okay.
Yeah.
We would like to check your blood sugar today as well.
Okay.
Have you noticed any increased perspiration or sweating?
At night, when I wake up in the morning, sometimes I have a lot of sweat.
Okay.
And the feet especially, too.
And do you remember for how long has that been going on?
That's been going on. That's sort of about the same time that the shakiness did.
Okay.
Yeah.
Are you taking any medications on a daily basis?
Yes, I take Wellbutrin and I take trazodone at night to sleep.
Okay. And how are you feeling with those?
Pretty good. Yeah,
Okay.
good.
When was the last time you had an increase in dosage on trazodone?
I started on 50 milligrams, and I've been taking it for 7 years, and they increased it to 100 within a month, and I've been on that dosage consistently since.
Okay. And Wellbutrin, when was the last time they increased the dosage?
I actually decreased it. I was on 300 and then I got back down to 150, so
Okay.
yeah.
That's good. Have you noticed any adverse effects?
Sometimes heightened anxiety
Okay.
and agitation, and I feel like it might be due to the Wellbutrin.
Okay. And the symptoms subsided after you decreased the dosage?
They've gotten better, yeah.
Okay. Any surgeries in the last 12 months?
No.
When was your last vision check?
2 years ago.
Okay. I'm going to go ahead and take your vital signs first.
Okay.
Can you please uncross your legs? Perfect. So I'm just going to first check if it's the right size. Perfect. Any hypertension in the family?
Nothing I'm aware of, no.
Okay. Blood pressure is normal. Going to go ahead and slide this down. Okay, so 110 over 65. And you've been staying in this range, so that's good. I'm going to check your pulses. I'm going to put 2 fingers right here below your wrist. Okay. Heart rate is also normal, 88. Okay, I'm going to put this on your index finger. We're going to measure your oxygenation. And have you noticed any flu-like symptoms?
No.
Okay. This will go under your tongue. Can you go ahead and hold that for me with your left hand? Perfect, thank you. Okay. Oxygenation 99% under air. Okay, you can go ahead and take it out. That's good. 96.9. It's also normal. Did you have anything cold to drink before you came in?
No, I had coffee. It was warm.
Warm, okay. And is it okay if I listen to your heart?
Yes.
I'm going to put the stethoscope onto the shirt. Is that okay?
Yes.
Okay. Okay. I can hear only S1 and S2. No S3, no S4. I'm going to listen for any murmurs. Go ahead and take a deep breath in and then hold it for 1, 2, 3. Breathe out. Good. Let's go ahead and do that one more time. Take a deep breath in and hold it for 1, 2, 3. Breathe out. Good. No murmurs. All right. Take a deep breath in and exhale strong. Good. And one more time. In and exhale. Okay. Again, breathe in. Breathe out. Okay. And again, breathe in. Breathe out. Okay. No signs of pulmonary fibrosis or pneumonia. I'm gonna have you change in a gown and then we're gonna start the examination.
Okay.
I'm gonna go ahead and put gloves on. Okay. I'm going to palpate your face and your neck. All right, let me know if you feel any kind of pain. Not feeling anything swollen. Checking head for asymmetry. Any pain here behind your ears?
No.
Okay, so that's the masseter bone. It's a good sign that there is no tenderness here.
Yeah.
Okay. Checking capillary refill. Your hands are pretty warm, so that's a sign of good circulation. Okay, I'm gonna have you put your arms like this in front of you. So we're looking for that shakiness. So let's go ahead and flip them. Good. Okay. I'm not seeing the shakiness. Is this what you describe as being shaky?
No, it more happens in the evening.
Okay, so it's
Yeah.
a lot worse than this.
Yeah.
All right. You can go ahead and relax. I'm just going to check some of your upper body strength now. So put your arms like this in front of you. I'm going to press down on your hands and arm. Don't let me press them down, so try to resist. That's good. Okay. All right. Decrease response on the left side. Keep them straight for me. Keep them straight. I'm going to try to push them up. Don't let me do that. Good. All right, perfect. And I'm going to try to open them. Don't let me do that. Okay. And close. Don't let me do that. Oh, I'm going to try to close them. All right, perfect.
Got it.
Go ahead and shrug your shoulders for me. I'm going to try to push them down. So try to resist. Shrug them again. All right, relax. Okay, so that was a little bit hard for you to do, right? It seemed like, is there some tension or pain behind the neck or
I
the
feel
shoulders?
like I carry all of my tension in my shoulders. Because I'm cold all the time and just stressed. I just kind of walk around like a little old lady sometimes.
Okay.
Yeah.
I'm going to try to push your chin that way. I'm going to need you to resist, okay? Okay, good. Okay, and now I'll place 2 fingers on the right side of your nose, and we'll do the same thing. Try to resist.
Try to look this way?
Yes. Okay?
Okay.
All right.
Okay.
And on the forehead. Okay? All right, good. Now go ahead and try to look down. Okay. And now try to look up. Okay. A little bit of decreased resistance in the temporal area. But otherwise, I would say it's a 2+, which is really good. Go ahead and look straight at my nose. I'm going to flash a light in your eyes. We're checking pupil dilation. Okay, I'm going to press down on your eyelid, looking for color. Good. And now can you please look right here? No rhythmic changes. Look here. A little bit higher. Look here now. Good. Okay, perfect. Okay, that was good. So now, as you keep your face straight, can you go ahead and follow my fingers without moving your face? So just with your eyes. Okay. Can you go ahead and look at my pen light right here? I'm going to bring it close to your vision, to your nose. Okay, a little bit of deviation on the right side. All right, was that very painful? Did you feel any pain as you were doing that?
I brought it close to my nose, yeah, a little bit.
Okay. I'm going to check your optic nerve. Okay, so we're going to start with your left eye. I'm going to have you look behind me straight at the wall. And I'm going to need you to not blink if it's possible. Okay, no deviation there. No signs of sclerosis either. Optic nerve is intact. I'm not seeing any sclerosis on this side either, which is let's go ahead and switch. Have you noticed anything coming out of your ear? Any abnormal discharge or pain?
No.
Okay. So I'm just going to take a look inside your ear. Okay. Tympanic membrane is pearl-gray. No signs of infection. There's no redness. Okay, a little bit of redness on the left side. And some redness behind the tympanic membrane. It does look kind of inflamed and angry.
Okay.
That could explain some of the symptoms that you're having. It could be a vestibular reaction. I'm going to make some vibration sounds and I'll put them behind your ear. So the tuning fork, the head of the tuning fork is going to be placed right behind your ear on your masseter bone. Now, can you hear this? Mm-hmm. Okay. Can you tell me when the vibration stops?
No.
Okay. And can you hear this? Mm-hmm. Tell me when it stops.
No.
Okay. Do you still hear anything?
No.
Okay. Now tell me when it stops again.
No.
Okay.
No.
Okay. Now I'm going to ask you to tell me which position here is louder, position 1 or 2. So this is 1.
Okay.
This is 2.
2.
Okay. This is 1 and 2.
1.
Okay. Okay, now we're going to try a different frequency. I'm going to have you close your eyes. And can you please tell me with which ear you hear the sound?
The left. Right.
Okay. What about now?
Left.
Okay, what about now?
Both.
right? So I have two frequencies. I'm going to have you try to identify the 256. So this is the one. Do you define this as high pitch or low pitch?
Compared to the other one, it's higher.
Okay, so try to identify the higher pitch sound and tell me with which ear you hear it.
Okay. The higher pitch is in my right ear.
Okay. One more time.
Higher pitch is in my left.
Okay. So no problems with your hearing. Okay. I'm going to ask you to close your eyes and try to take a deep breath in and breathe out. What does this smell like?
I didn't smell anything.
Okay. Let's go ahead and try that one more time. Take a deep breath in and breathe out. What does that smell like?
Cherries.
Okay. Now I'm going to place just a piece of paper on your tongue. Go ahead and try to taste this and tell me what it tastes like.
Bitter.
I'm so sorry. Okay, so that's good. That's one. What about this one? Is it bitter again?
Really bitter.
Okay.
Even more bitter.
Which one was more bitter, the first or the second?
The second one, yeah.
All right, and that is normal. Okay. What I'm going to have you do now is I'll have you lay it down and we're going to examine your back and your abdomen.
Okay.
I'm going to go ahead and just slowly palpate the base of your skull. I'm looking for spine deviations. We're also checking for any bulging discs. Go ahead and tell me when you don't feel the vibration anymore. Okay. To take some measurements, we're looking for asymmetry and changes in curvatures. This is a good indication of inflammation, and if there's any kind of problems with the spine. Okay, so thoracic, it's about 11.1. All the way to lumbar, 9.8. It's 16.5. Okay. I'm going to touch you with two textures. One, it's going to feel sharp. It's kind of pointy, but definitely it's not going to penetrate the skin in any way. It's just enough pressure so that your brain perceives it as a painful stimulus. I'm going to go ahead and show you what that feels like. Did that feel sharp?
Yes.
Okay. And then I have a dull object. It's basically a brush that can elicit that dullness feeling. Okay, did that feel dull?
Yes.
All right. Now go ahead and tell me if you feel sharp or dull. Okay. And does this feel cold or warm?
Cold. Warm. Cold. Cold. Cold.
Okay, now I'm gonna introduce all three. Go ahead and tell me if it feels cold, dull, or sharp.
Dull. Dull. Sharp. Cold. Dull. Sharp. Dull. Sharp. Dull.
Go ahead and tell me if you feel this on the left or right side of your spine. Okay, good. Okay, I'm gonna have you flip over on your back now. Go ahead and just slowly palpate your abdomen here. Let me know if you feel any kind of pain. I'm looking for liver size and stomach. Normal sound. Can you go ahead and tell me if this feels sharp or dull?
Dull. 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 Sharp. 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 Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp.
Go ahead and tell me if you feel this 2 or 1 pressure point.
1. 1. 1. 2. 2. 1. 2. 2.
That's about 14. 18.5. Okay. Alright, I'm gonna have you stand up and we're talking about these results and classes. Okay, Katie. There were definitely some neurological deficits that I would like to check again. And for now, we're just going to go ahead and watch. I don't think there's any necessity to perform any invasive procedures.
Okay.
I'm going to have you come back in 1 week.
Okay.
And give me a call if you notice anything getting worse. Okay?
All right.
All
Thank
right.
you.
You're welcome. I'll see you soon.
All right.